Most seniors over 60 are doing something every single day that they believe is protecting their bones. But in my practice, I've watched this same habit gradually weaken leg strength in older adults who had no idea what was happening. This isn't about calcium deficiency. This isn't about osteoporosis medication. This is about a pattern I see repeatedly in patients over 65 who come to me confused about why their legs feel weaker, why balance has become harder, why getting up from a chair takes more effort than it used to. And the surprising part is that many of them are doing exactly what they were told would keep their bones strong. In my years working with older adults, I've noticed something that rarely gets discussed in standard health advice for seniors. We focus heavily on bone density, on preventing fractures, on making sure calcium intake is adequate. All of that matters, but there's a blind spot in how we talk about bone health that's affecting leg function in ways most people over 60 don't realize until the damage has quietly progressed. I'm bringing this up because I've had too many conversations with patients in their 70s and 80s who feel betrayed by their own bodies. They followed the advice. They took their supplements. They avoided the foods they were told to avoid. And yet, their legs feel different, weaker, less stable, less responsive. And when we dig into their daily routines, the same pattern emerges almost every time. Here's what's happening. Many seniors have been told that protecting their bones means being extremely careful with physical activity. They've been warned about falls. They've been told that high-impact movement is dangerous after a certain age. They've been cautioned about anything that might jar the skeleton or stress the joints. And so, with the best intentions, they've shifted their entire relationship with movement toward what feels safe and protective. The problem is that bones don't exist in isolation. Your bones are surrounded by muscles, tendons, ligaments, and a complex network of nerves that communicate constantly with your brain about where your body is in space. This entire system needs regular, varied stress to stay functional. When we remove that stress in the name of bone protection, we're actually undermining the very system that keeps bones strong and legs capable. Let me explain what I mean by stress. I'm not talking about emotional stress. I'm talking about mechanical load, weight-bearing, resistance, the kind of physical challenge that tells your muscles and bones they need to maintain their strength because they're being used. In older adults I've treated, the most common mistake is eliminating this kind of healthy stress entirely while focusing only on passive bone protection through supplements and diet. Here's the reality that surprises most of my patients over 60. Bone density is only part of the equation. You can have decent bone density and still lose the ability to walk confidently, climb stairs safely, or recover your balance when you stumble. That's because leg strength and stability depend on something called neuromuscular coordination. It's the connection between your nervous system and your muscular system. It's what allows you to react quickly when you start to fall. It's what keeps your legs steady when you stand on one foot to put on a shoe. It's what prevents that feeling of your legs giving out unexpectedly. And here's the part that connects to what I'm seeing in my practice. This neuromuscular coordination deteriorates rapidly when movement becomes too cautious, too gentle, too controlled. Many seniors are walking only on flat, even surfaces. They're avoiding stairs. They're sitting down whenever possible to reduce time on their feet. They're eliminating any activity that involves quick direction changes or reaching movements. All of this is being done with the belief that they're protecting fragile bones from fracture risk. But the human body interprets this pattern as a signal. When you stop challenging your legs with varied movement, your nervous system begins to prune the neural pathways that control complex motor patterns. Your muscles start to atrophy because they're not receiving the signals they need to stay strong. Your balance reflexes slow down because they're not being practiced. Your bones, ironically, can actually become weaker because bone remodeling depends on mechanical stress. Bones build density in response to the loads placed on them. What I see in many patients over 70 is something I call cautious movement syndrome. It's not a medical diagnosis. It's a pattern. These are people who move carefully, slowly, deliberately at all times. They've trained themselves to avoid anything that feels unstable or unpredictable. They sit down to put on pants. They hold on to walls when walking through their home. They never move quickly. They never test their balance. They never put their legs through anything that feels remotely challenging. And over months and years, this cautious approach creates exactly what they were trying to avoid. Their legs become genuinely weaker. Their balance becomes genuinely worse. Their risk of falling actually increases because when an unexpected slip or trip happens, their body has lost the reflexes and strength needed to catch themselves. The irony is profound and heartbreaking. Here's the insight that changes everything for my patients when I explain it. Your legs need to be stressed in order to stay strong, not injured, not overworked, but genuinely challenged on a regular basis. This is true at any age, but it becomes critically important after 60 because the margin for error gets smaller with each passing decade. The bone health habit that's quietly weakening seniors' legs is this excessive caution combined with the belief that stillness equals safety. Many older adults have been taught that the best way to protect their bones is to minimize physical risk. Rest more, move less, avoid anything strenuous, take calcium, take vitamin D, and wait for your bones to stay strong through supplementation alone. But bones are living tissue. They respond to how you use them. When you walk on varied terrain, when you climb stairs, when you carry groceries, when you stand up from a low chair without using your hands, you're sending signals to your bones that they need to maintain density and strength. When you eliminate all of those challenges, your bones receive the opposite signal. They begin to remodel in ways that reduce density because your body is efficient. It doesn't maintain systems that aren't being used. This is what I mean when I say the habit is quietly weakening legs. Most seniors don't notice the change day to day. They don't wake up one morning unable to walk. Instead, it's gradual. Stairs feel harder. Standing from a seated position takes more effort. Walking for more than 10 or 15 minutes becomes tiring in a way it didn't used to be. Balance feels less automatic. There's a hesitation that wasn't there before. And because it happens slowly, many people attribute it to normal aging. They assume this is just what happens after 65 or 70. They accept it as inevitable. But in my medical practice, I've seen too many examples of older adults who reverse this pattern to believe it's simply age. The difference is usually movement, specifically the willingness to challenge the legs regularly with progressive, appropriate resistance and balance work. Let me be very clear about what I'm not saying. I'm not suggesting that seniors should ignore fall risk. I'm not recommending reckless behavior or high-impact exercises that genuinely could cause injury. What I'm talking about is the difference between appropriate caution and excessive protection. There's a middle ground that most of my patients over 60 haven't been told about. Appropriate caution means being aware of your environment, removing tripping hazards from your home, using good lighting, wearing proper footwear, and knowing your limits. Excessive protection means eliminating all physical challenge from your daily life because you're afraid of what might happen. The first approach maintains independence. The second approach gradually erodes it. The seniors I work with who maintain strong, functional legs into their 70s, 80s, and beyond are almost always people who have stayed physically active in ways that challenge their neuromuscular system. They walk on uneven surfaces sometimes, not just flat sidewalks. They practice standing on one leg while brushing their teeth or washing dishes. They climb stairs regularly, even when an elevator is available. They carry their own groceries when they're able. They get up and down from chairs and the floor without always using their hands for support. These aren't extreme athletes. These are regular older adults who have somehow avoided the message that stillness equals safety. And their legs reflect that choice. They move with confidence. They recover their balance naturally when they stumble. They don't have that fearful, hesitant gait that becomes so common in seniors who have adopted excessive caution. So what does this mean practically for someone over 60 who recognizes this pattern in themselves? The goal is to gradually reintroduce healthy mechanical stress to your legs in ways that are progressive and appropriate for your current fitness level. This isn't about pushing yourself to exhaustion or doing anything that causes pain. It's about consistently asking your legs to do slightly more than they're comfortable with. Start by honestly assessing where you are right now. Can you stand from a chair without using your hands? Can you stand on one leg for 10 seconds without holding on to something? Can you walk up a full flight of stairs without stopping? Can you walk for 20 minutes without significant fatigue? These are basic functional markers that tell you about leg strength and endurance. If any of these feel difficult or impossible, that's not a sign that you're too old or too far gone. It's information. It tells you where your baseline is and what needs attention. And the encouraging reality is that leg strength responds to training at any age. Studies in people well into their 80s and 90s have shown that appropriate resistance training can increase muscle mass, improve balance, and reduce fall risk, even in very old adults. The key word is appropriate. For most seniors, this means starting with body weight movements that challenge stability and strength without requiring equipment or gym memberships. Sitting down and standing up from a chair repeatedly is one of the most effective leg strengthening exercises available. If you can't do it without hands, use your hands, but try to rely on them less over time. If you can do it easily, try it from a lower surface like a coffee table or ottoman. Walking remains one of the best activities for maintaining leg function, but the type of walking matters. Walking on a flat treadmill at a slow, steady pace is better than nothing, but it doesn't challenge your neuromuscular system the way varied terrain does. If you're able, include some walking on grass, gravel, or gentle hills. Change your pace occasionally. Walk slightly faster for 30 seconds, then return to your comfortable pace. These variations force your legs to adapt and respond to different demands. Stairs are another powerful tool that many seniors avoid unnecessarily. Obviously, if you have severe knee arthritis or a specific medical reason to avoid stairs, follow your doctor's guidance. But if you're avoiding stairs simply because they feel harder than they used to, that's often a sign that you need to do them more, not less. Start with just a few steps. Hold the railing. Go slowly, but do them regularly. Your legs will adapt if you give them consistent practice. Balance work is something I recommend to almost every patient over 65. It doesn't require any equipment and can be done throughout the day in small moments. Stand on one leg while waiting for coffee to brew. Stand on one leg while talking on the phone. Start with just a few seconds and progress gradually. If balance feels very unstable, stand near a counter or wall so you can catch yourself if needed. But try not to touch the support unless you actually start to lose balance. The challenge is what creates adaptation. One pattern I encourage people to break is the habit of always sitting down to do tasks that could be done standing. Many seniors sit to put on shoes, sit to fold laundry, sit to chop vegetables, sit whenever any task will take more than a minute or two. While sitting isn't harmful in itself, spending 12 or 14 hours a day in a seated position means your legs are rarely being asked to support your body weight or maintain your balance. Simply standing more throughout the day creates low-level leg engagement that adds up over time. Another practical change is rethinking how you use your hands for support. Many older adults have gotten into the habit of pushing off with their hands every single time they stand up, even when their legs are perfectly capable of doing the work. Over time, this creates dependence. Your legs get weaker because they're not being used fully. Try standing up without hands occasionally, even if it feels harder. If you can't do it yet, that's fine. Work toward it gradually. But recognize that hand dependence is often a choice, not a necessity. For people who want more structured guidance, working with a physical therapist who specializes in geriatric care can be incredibly valuable. They can assess your specific limitations and create a progression that's tailored to your body and medical history. Many seniors assume physical therapy is only for recovering from injury or surgery, but it's actually one of the best preventive tools available for maintaining functional independence. I also want to address the fear component directly because it's often the biggest barrier. Many seniors avoid challenging their legs because they're afraid of falling. That fear is understandable and not irrational. But the paradox is that avoiding challenge because of fall fear actually increases fall risk over time. The way to reduce fall risk isn't to eliminate all unstable situations. It's to practice instability in controlled ways so that your body remembers how to respond when unexpected instability happens. This is why I encourage practice in safe environments. Stand on one leg next to a sturdy counter. Walk on slightly uneven ground in your backyard where falling would mean landing on grass. Practice sitting down and standing up from low surfaces while a chair or wall is nearby for support if needed. The goal is to train your nervous system to handle unpredictability while minimizing the consequences if you do lose balance. What I want seniors to understand is that leg weakness after 60 is not inevitable. It's not a sentence you have to accept. Yes, aging affects muscle mass and bone density. Yes, recovery takes longer as we get older. Yes, certain medical conditions can limit what's possible. But for the vast majority of older adults I work with, significant functional improvement is achievable when they're willing to challenge their legs consistently and progressively. The dignity and independence you want to maintain in your later years depends heavily on your legs. Being able to walk where you want to go, stand long enough to cook a meal, climb stairs to visit family, get up from the floor if you need to, recover your balance when you trip. All of these capabilities are trainable. They're not fixed. They respond to how you use your body day after day. I've watched patients in their late 70s regain the ability to walk without a cane. I've seen people in their early 80s rebuild enough leg strength to travel independently again. I've worked with seniors in their mid-60s who thought their walking days were ending, only to discover that consistent leg strengthening allowed them to hike with their grandchildren. These aren't exceptional cases. They're examples of what becomes possible when someone decides that protecting their bones doesn't mean eliminating movement. The habit of excessive caution may feel like it's keeping you safe, but if it's making your legs weaker, it's actually moving you closer to the very outcomes you're trying to avoid. Fractures happen when people fall. Yes, but people fall most often when their legs are too weak to catch them or their balance is too poor to recover. Strength and stability are protective. Movement is protective. Challenge, when done appropriately, is protective. As you age, one of the most important things you can do is stay aware of how your body is actually functioning, not how you assume it should be functioning. If your legs feel weaker than they used to, if balance feels less automatic, if you're avoiding activities that used to be easy, those are signals worth paying attention to. They're not signs that you're too old. They're invitations to rebuild what's been lost. Talk to your doctor about leg strength and functional mobility, especially if you've been focused primarily on bone density, without considering the muscular and neurological components that keep legs working well. Ask about physical therapy. Ask about appropriate exercises for your specific situation. Stay curious about what your body is capable of. Staying informed about how your body works and what it needs is one of the most powerful tools you have as you age. The choices you make about movement today will shape your mobility and independence 5, 10, 15 years from now. Your legs are still capable of more than you might think. Give them the chance to prove it.